Okay, so for our article, it was called Examining the Effects of Thought Records and Behavioral Experiments in Instigating Belief Change. And there was this overview of CBT therapy. And the definition of cognitive behavioral therapy is that it's a type of behavioral therapy that helps people learn how to identify and change destructive or disturbing thoughts that might have a negative influence on behavior and emotions. And in the medical field, this could be used to help treat mood disorders, anxiety, personality disorders, eating disorders, addiction, dependency, tic, and psychotic disorder. And then for the intro and hypothesis part of the article, why was this study done? It was done to help see which components used in CBT behavioral experiments or thought records are more effective. And they're both used a lot within cognitive behavioral therapy, but there hasn't been many studies comparing the two to see which one will be more effective, mainly in the concept of belief change. And then the hypothesis was that it compared TR to BE to a control intervention in affecting belief and analog symptom change within a single session intervention. And both TR and BE intervention can help reduce those within the study's behavior as well as anxiety ratings on a standardized symptom measurement scale compared to the control interventions.
This study in particular used two intervention techniques: thought records, where the participants analyzed their beliefs by writing it down, then they examined the evidence for and against the beliefs, then they developed balance or alternative beliefs. The second intervention technique would be behavioral experiments. They designed an experiment to test the belief, predicted the outcomes before conducting the experiment, carrying out the experiment, and then reviewing the results. Finally, they reflected on how the results challenge or confirm their beliefs. The study design had 91 participants who were randomly assigned to three conditions: the thought record intervention, the behavioral experiment intervention, and then a control group who had no active interventions. These were done in single session interventions, with assessments done pre-intervention, post-intervention, with a 1 week follow-up. The methods of the study had both methods and ratings. The methods, they wanted to get as big as a sample as they wanted, and but they also needed to find a belief that most people might have but wasn't found too irrational. About 32% of the people within their sample don't wash their hands after going to the bathroom. This is something that they can use TR and BE for ethically, since it might give those within the study some anxiety about the possible outcomes. The ratings within the study rated their convictions of the scale of degrees within a statement, which reflected the specific belief they were trying to target within that specific intervention, which are the belief ratings. They would also rate how much emotion a situation might give them as well, which were the anxiety ratings. In the study, the measures that they were looking for were the belief behind not washing your hands and if that would make you sick, and how much anxiety that might give you if they would have to go to the bathroom without washing their hands. They were also asked how likely they would do that within the next week, not washing their hands when they go to the bathroom. The measures used in this study were the belief ratings, where it measured the strength of the belief in a target statement from a 0 to 100% scale, the anxiety ratings, which were the anticipated anxiety in situations related to the belief, the behavior ratings, which were the likelihood of engaging in behavior tied to the belief, and symptom measures, which were the standardized tools to assess the overall mental health.
The procedure, those within the study were randomly put into one of the three conditions and then asked to complete the measures. All experimental conditions lasted for a 30-minute duration. The standardized symptom measures were used to assess the possible wider impact of these interventions using the Obsessional Beliefs Questionnaire 55 and the International Belief Inventory. The scale to assess therapeutic relationship, patient version, or STAR, and credibility expectancy questionnaire were used to assess the credibility of the interventions used in this procedure. The control group did not receive active interventions like the three other groups, but they spent 30 minutes reading a neutral text. They also completed the pre- and post-intervention measures and follow-ups. The results were the study found no significant difference between groups in terms of demographic variables such as gender, age, education level, ethnicity, or previous psychological treatment. This ensures that the groups were comparable before the intervention. There was a significant difference between groups on belief ratings, post-intervention, and at follow-up. Both TR and BE interventions showed a beneficial impact on belief change compared to the control group. However, BE demonstrated a small advantage by affecting earlier change and generalizing to beliefs about others as well as oneself. The results were credibility ratings. Thought records were found to be marginally more credible than behavioral experiments, but this difference was not statistically significant. Overall, TR and BE showed significant improvements compared to the control group, reduced belief strength in the target statement, lower anxiety levels associated with the belief, increased likelihood of engaging in challenging behaviors.
The discussion was that TRs and BEs were both therapeutic for this type of intervention. BE intervention was more effective for being able to reduce the overall endorsement of the belief of not washing your hands after going to the bathroom will make you sick. BE has more advantage overall compared to TR. There were more improvements within the behavior ratings with BE than TR. This study shows that BEs might be more effective as an intervention compared to TRs. Some limitations in future research of this is that being able to use a non-clinical sample would be helpful in also figuring out how effective both BEs and TRs are. It would be useful to be able to use actual therapists for this intervention instead of graduate students. This study uses measures that aren't normally used within studies. The sessions within this study aren't standard for CBT, as CBT uses sessions that are much longer than what was used in this study. In conclusion, both BEs and TRs are effective in getting therapeutic change, but overall BEs are more effective than TRs. BEs are more effective because the change that you see that happened to you happens earlier and goes further compared to TRs. And here's our reference.